All right, great. So I'm Andrea Ruth, and I want to welcome you to the SRQ Strong Community Conversation tonight. We hold these conversations monthly. Sometimes they're virtual like we are tonight, and sometimes they're live and in person. So we want to welcome you and thank you very much for joining us. We're going to have a great conversation tonight called The Journey to Becoming Trauma Informed. Reports from 4 agencies serving people who are homeless. So that's the topic tonight. We want to thank the new and the returning members of our community for joining us. As I said, I'm Andrea Ruth. I'm going to be your moderator tonight. I've been on the SRQ Strong Planning Committee for I think 5 years now. And I also have worked with all 4 of these agencies that you're going to hear from tonight who are becoming trauma-informed organizations, which we'll talk a little bit about as we go through the night. A few housekeeping items. So please keep your microphones on mute until the end when we'll have an open conversation and we'll ask people for questions, comments, anything you want to share about what you heard. So you'll get a signal from me when we're at that point of the conversation. And if you do have questions or comments during the talks and you just don't want to lose your train of thought, you could put it in the chat on your Zoom, use the chat function. Annalise will be monitoring that for us. So at the end of the night, we'll go back and pick up your question. You can also, some people are on Facebook Live, and I know that there's a function there where they can put questions, and Annalise is going to monitor that too. So she's going to be very busy tonight. Thank you, Annalise. As I said, we are recording this conversation tonight, and we're also streaming it on Facebook Live. So it'll be available to you later. SRQ Strong always sends the link to the recording out after a few days after the conversation. We'll do a little editing of things that happened in the beginning before you joined us and don't really need to be part of the conversation. So since we're recording, if you don't want to be recorded, that's perfectly fine. We invite you to just turn off your camera, turn off your video, and you can still listen in and see the rest of us, but your face will not be recorded, in the official recording. So if you're new to joining an event like this with SRQ Strong, Annalise put up our logo and our mission and vision. So we're a growing group of Sarasota County neighbors committed to learning about trauma and responding to its impact. So these kinds of conversations fulfill on both parts of that vision. Our mission is to promote community-wide trauma awareness through healing, education, action, and leadership. So someone's saying that once in a while I cut out in sound. Are you all having trouble hearing me? Okay, sorry about that. It may be on your end.
Yeah, I hear you just fine.
Okay. So we are, our vision is to really be a community, come together as a community that cares for itself. And Sarasota Strong's community is getting bigger and bigger, larger and larger as the years go by. So during the pandemic, as you know, everything went virtual. And so did SRQ Strong's community conversation. And as part of that, we ended up with people joining us from other states, even from other countries. So I know there are a few people on this conversation from the Kansas City area, from Missouri. I'm sure we've got people from other places. So our community is getting larger, and we love that. So one of the things that you can do if you want to get more involved in SRQ Strong is be a part of these monthly conversations. And you can also go to our website, which is there, or send an email to sarasotastrong@gmail.com. If you want to go to the website, it's www.srqstrong.org. And there are ways that you can sign up for workshops and trainings and be on our mailing list and all of that. So please engage with us. We'd like to hear from you about other community conversation topics you'd like to hear. That would be a great thing to send to that email address. So for tonight's presentation, we're going to hear from 4, maybe 3 organizations. I'm not sure if John Lopez from Harvest House is able to join us, but these are organizations who have been working now for over a year to become more trauma informed. And they'll say a little bit about what that means for them and what some of the things are that they've taken on. I will tell you that it's no easy task. These organizations have lots of business to do in serving people who are homeless and all of the programs that they do. And then they've also taken this on. And so we acknowledge them for that, and we appreciate that in our community. This project we call Project Heal is helping people, helping everyone align with love. And it was is funded by an anonymous donor, a very generous anonymous donor to the Gulf Coast Community Foundation. So tonight I noticed that Jennifer Johnston was on from the Community Foundation. Also, Christy Nolan is here, and she's the project coordinator. So we just really appreciate our foundations here locally, and the Gulf Coast Community Foundation has been a wonderful partner in this project. So let me tell you a little bit about Project Heal. We have been through some education about trauma, about its impact, about early childhood experiences, what that does to our brains and our bodies. We have done deeper dives into that with some of the teams from these 4 agencies. We have done some, we had a partner in our facilitation group who did some site visits and really sat down and helped the organizations look at where they are on the journey of becoming trauma informed and what are some of the things in addition that they could do. And then my partner, Kathleen Harnish-McCune, is on the line. Hi, Kathleen. Kathleen and Team Tech, her company, came in and we did individual organization retreats where we actually did some strategies, put together some strategies and some action plans for what these organizations can take on in the next year or 2. So there's been a lot of additional work. That's what I really want to highlight here, a commitment of these organizations to learn about trauma, to learn about what it does to us, to learn about its impact, and to look at what adjustments do they as organizations need to make in their policies, in their practices, in their programs to really align with the principles of trauma-informed organizations, which are safety, trustworthiness, choice, collaboration, and empowerment. And in those words, you can kind of pick up that it's very important that we engage the people we're serving, the people we're working with, the clients, the families. And so a big portion of what these organizations are doing is engaging the people that they're there to help. So tonight, we also have with us someone who has lived experience as a person who was homeless and is going to talk a little bit about that and how one of the agencies here helped her. So let me introduce our speakers for tonight, because you don't need to hear any more from me and you want to hear from them. So first of all, we have Taylor Neighbors, who is the Chief Administrative Officer with Suncoast Partnership to End Homelessness. And Taylor's been working with that organization since 2017. Before that, she was with the 211 Suncoast system, assisting individuals and families experiencing homeless or at risk of being homeless. She has her master's in applied aging sciences, which I didn't know, Taylor. That's great. Applied aging sciences and Bachelor of Arts in interdisciplinary social sciences with a secondary concentration in psychology and social work. And that's all from the University of South Florida. She also earned a certificate in aging studies from Virginia Commonwealth University. She's an avid runner. She enjoys being outdoors, reading, and spending time with her fur niece. I love that. You have a fur niece. All right. So then we also, if he can join us tonight, we're going to have John Lopez, who's the Director of Addiction Services with Harvest House. And he's a licensed mental health counselor. He's certified a certified addiction professional who specializes in trauma. He's working on his doctorate in counseling and psychology. And for 20 years now, John has worked with adults who suffer from addiction and substance use disorders. He's served as the local youth pastor at a local church, and he focuses on the needs of the Latino community. We also have Jennifer Fagenbaum with us. She's the Executive Director of Family Promise of South Sarasota County, and that's located in Venice. And Jennifer has a Bachelor of Science degree in Family and Consumer Science Education and Child Development and Family Studies. She's worked with a lot of schools and community colleges, working with high school students and young adults. And she's now, as the Executive Director of Family Promise of South Sarasota County, she's been increasing their fundraising efforts. And I can tell you that Jennifer is a real go-getter down there in the Venice area. Her agency is very well respected, and you'll love hearing from her. And then we also have PJ Brooks with us, who's the Chief Operating Officer for CASTLE, which is Community Assisted and Supported Living. I want to apologize to PJ and the CASTLE team because I noticed that our flyer said supportive living, and I always get that confused, and I'm sure that's on me that happened. So PJ's a licensed mental health counselor. He has over 33 years of providing leadership and development of programs that assist people in need of intervention across a broad spectrum of care and multiple environments. PJ is very well respected in the arena of behavioral health, and you will hear that in his speaking tonight. He's very involved and engaged in the Sarasota County area, and it seems like he is at every meeting I attend. So PJ keeps his ears to the ground, and he's very known in the community. He's an advocate and a champion for behavioral health, not just at the local level, but also the state and regional level. And finally, we have Kelly Geeson. And Kelly, we are so happy to have you joining us. Kelly is going to tell her story tonight, a little bit of her story and how she has been assisted and supported by the CASTLE team. And I want you to know that Kelly jumped in at the last minute because our planned speaker, as the person with lived experience, got sick today. So Kelly jumped in, and she's just ready to be here with you all and let the community know what it's like to go through these experiences and what that means, and then to give you her story of hope. So thank you, Kelly, for being with us. All right, so I'm going to now turn the microphone over to Taylor. who is going to give us, because of the role of Suncoast Partnership to End Homelessness, we'll get a little overview, I think, as Taylor speaks, of the whole system in our area that serves people who have housing needs. So Taylor, I'll turn it over to you.
Thanks, Andrea. Well, good evening, everyone. I am grateful for this opportunity to speak with you all this evening and share a bit about what we do as an organization and outline our journey thus far as becoming a trauma-informed organization. Suncoast Partnership was established in 2005, and we are the HUD designated lead agency of the FL 500 Continuum of Care, or COC. The COC is comprised of agencies, government entities, advocates, those with lived homeless experience, and other stakeholders within Manatee and Sarasota County that are committed to preventing and ending homelessness. As such, Suncoast Partnership leads this effort in the community by utilizing best practices and responding in a trauma-informed manner. Suncoast Partnership provides primarily administrative services, but we do have a few of our staff members that work directly with clients that are experiencing homelessness or at risk of becoming homeless. So first, I'm going to kind of explain our administrative services. So each year, HUD releases what we call a Notice of Funding Opportunity, or a NOFO, and this funding is related to projects that focus on permanent supportive housing, rapid rehousing, coordinated entry, HMIS, et cetera. So what happens is Suncoast Partnership will release what we call a request for proposals, which is basically an RFP. And agencies within our COC can apply for these funds. We have a review and ranking committee that basically scores these projects. And the projects that are selected, we as the collaborative applicant at Suncoast Partnership actually apply and respond to HUD's NOFO. The projects that are basically funded through HUD, it's our responsibility to monitor the performance and project compliance. So in addition to being the collaborative applicant for the HUD NOFO, we also receive funding, what we refer to as pass-through funding, from the state of Florida Department of Children and Families, as well as the local government. And we basically subcontract those funds out to our providers, and we handle all of the invoicing related to those contracts, and then we monitor contract compliance with that. Another key piece of what we do here at Suncoast Partnership is we administer what is known as the Homeless Management and Information Systems, or locally we refer to that as the Community Information System. And that's basically a database where all of our providers can import information related to clients that are accessing various services in the community. So it's a way of collaborating with one another, ensuring that there isn't duplication of services and efforts. And we use the data that's entered into our system for reporting. Basically, the data tells the story, and that's what drives the funding in this community. In addition to those administrative functions, we also manage the coordinated entry process, which is basically designed to identify those that are experiencing homelessness within the community and prioritize folks for housing interventions. We have a team member who also applies for disability benefits and mainstream benefits for those that are experiencing housing instability. We have other staff in our office that are working to build relationships with landlords and any of the housing rentals that are located, basically connecting agencies with those landlords to house clients. And we now what I'll do is I'll talk a little bit about some of the direct services that we provide here at Suncoast Partnership. We have a department that focuses on diversion and early intervention services. And basically what that's designed to do is to divert people away from entering the homeless crisis response system, or if someone does enter the system, helping them rapidly resolve their housing crisis through creative conversations and problem solving, which could range from landlord-tenant mediation, flexible funding, helping people get connected to their support system, maybe out of state, or helping them double up maybe with friends and family while they try to resolve that crisis. We also perform street outreach services, so that connecting those that are experiencing literal homelessness to our homeless crisis response system and housing interventions. We have a designated person in our office that works with the judicial system in our community care court sector. So you guys have seen that we provide a lot of comprehensive services. So you may be wondering how we're funded. We are funded by a variety of different sources. We receive funding through the federal, state, and local government, as well as private foundations and donations. So through the generosity of Gulf Coast Community Foundation, Suncoast Partnership applied and was accepted into the Project HEAL cohort to become a trauma-informed organization. We embarked on this journey for a few reasons. First, as the lead agency, we knew that we had to become trauma-informed, as we desire everyone within this continuum of care to be trauma-informed. And to do this, we knew that we needed to lead by example, which meant we needed to understand the neuroscience behind trauma and the impact it has on ourselves, our peers, our providers, and clients, and how we can effectively respond to trauma utilizing best practices and ensuring that we aren't re-traumatizing folks or augmenting their trauma. So understanding the complexities of trauma and understanding that people who have experienced trauma are resilient is critical. And having such information has really enabled our staff to understand one another, our providers, and our clients. I once had a leader tell me that when you know better, you do better. And there's so much truth to this. It enables us to really show up as our best selves when working with our clients, whether that's a provider on our admin side or our clients that are directly experiencing a housing crisis. Additionally, when our agency applied to be a part of the Project HEAL cohort, we were witnessing, firsthand and secondarily the impact COVID-19 had, as well as Hurricane Ian. And then, of course, unfortunately, our housing crisis here in Sarasota and Manatee County. We really witnessed a lot of vicarious trauma. A lot of our staff were really struggling with this. I feel like vicarious trauma is not something that a lot of people really understand, and sometimes it's not talked about, but it's really important that we have these conversations surrounding this and that we're able to effectively address this. So through the trainings that we've had and the Learning Collaborative with Project HEAL, our staff have really been given the additional tools to add to their toolboxes to effectively address the vicarious trauma experienced and really practice self-care and understand that it's okay to practice self-care. We need that in order to function effectively as helping professionals. One of the great things about Suncoast Partnership is that we offer an insurance plan to our staff that is fully covered. And our insurance provides free counseling services. So we are always encouraging our staff to take advantage of this. We counsel each other, but sometimes you really need that neutral party and that can give you that honest feedback and really doesn't, that's impartial to this. So anyway, so while on this journey to becoming a trauma-informed organization, we are actively undergoing transition. We have an interim CEO that we're very blessed to have. So anytime you have a transition, it can be challenging as you're trying to kind of get used to things and things that are changing. So we've just kind of adapted and rolled with that. I always say when you're working with a nonprofit, it requires a high level of adaptability and flexibility. So we went from working primarily remote due to the pandemic to now operating more of a hybrid model. So we're in the office a couple times a week, getting together, team building. Like I said, it is a hybrid. So we do have that flexibility sometimes to work from home. So it's kind of the best of both worlds. Every week we have a staff meeting in person. And what we try to do is open the staff meeting and share, a positive thing that we did the week prior to prevent and end homelessness, or, icebreakers or positive affirmations. I can't stress enough how important the team building is because every job here at Suncoast Partnership is interconnected, and we have to have a strong team in order to effectively address the housing crisis in this area. So what we plan to do in our journey is to have a staff retreat at Resilient Retreat. We hope to be able to offer those staff retreats at least once a quarter. So to help with our team building and then practice that self-care. So as we continue our efforts to become a trauma-informed organization, we have a few items out there that are on the horizon that we're working towards. And these include, we're going to be undergoing and participating in the Everyone's a Leader course so that we can develop our facilitative leadership skills so that we can effectively lead our community to prevent and end homelessness in a trauma-informed manner. We're going to be hosting a training next month in partnership with the Florida Housing Coalition on self-care. In August, we're going to be hosting a celebratory breakfast for our COC at the annual Continuum of Care meeting. We're also looking at training opportunities that we can bring to our COC focused on trauma, vicarious trauma, burnout, self-care, and how to address some of those factors. We are evaluating our HR practices, our handbook, our policies and procedures to really make sure that we're incorporating those elements of becoming a trauma-informed organization. I sat down with our team today in our staff meeting and we talked about, and we're so grateful for this, that Gulf Coast Community Foundation and the grant reviewers are giving all of us in this cohort an opportunity to kind of reevaluate our proposals and kind of fine tune those. We've really learned a lot through the Learning Collaborative and learn from our partners as well. So we're excited to get that proposal revised and just continue on our journey. And just wanted to mention that in closing, we are really grateful for Gulf Coast Community Foundation for this opportunity. And Andrea, it's been a pleasure getting to know you, as well as Kathleen from Team Tech and all of our Project HEAL cohort members. We're learning so much from each other and really appreciate this journey of professional and personal growth. Thank you.
Unmute. Thank you so much, Taylor. Thank you for that overview too. I think it helped people connect to the system, what the COC is, et cetera, because we got to remember that some of the people on this call may not know a lot about what's available, right, in our community related to housing and the services that come along with that. So thank you. And I've enjoyed getting to know you too. So let's go to our next speaker. I don't think John Lopez made it on the call, but John, if you're here like on a phone that I don't recognize you, will you please make yourself known? Okay, I don't think John made it tonight, and we'll check in to make sure he's okay, but we will get some information out to you about Harvest House and what they're up to. I think we're a little behind on our timeline, so I'm going to go ahead and go on to our next speaker, and we'll make sure we get some information out to you about Harvest House. They're a great resource and a great agency in our area. So let's go to Jennifer Fagenbaum then of Family Promise of South Sarasota County. Jennifer, will you let us know what you guys are up to? And again, I want to remind you all that if you have questions or comments, you can put them in the chat and we will have an open conversation toward the end of this meeting. So Jen, take it away.
Thank you, Andrea. I am Jennifer Fagenbaum. I'm the Executive Director of Family Promise of South Sarasota County. We opened in Venice in late 2015. A group of community members got together and met with Gulf Coast Community Foundation and some other people and said, hey, we've got this problem. There's a lot of homeless families in our county and we need to figure out what to do. Someone got a hold of Family Promise National because Family Promise is a national organization. There are 211 Family Promises across the country. National sent somebody down to meet and got everything started. And so we opened in late October 2015. We do serve families with minor children in South Sarasota County. There is another Family Promise that serves North County. So if people are from Sarasota or Bradenton, the Family Promise Sarasota Manatee serves the north side of the county and Manatee County. We do talk to them and communicate with them, but we're our own separate agency. So we serve South Sarasota County, that is Osprey, Nokomis, Venice, Inglewood, and Northport. And we have several programs that serve families that are homeless with children, families that are at risk of becoming homeless, that are struggling financially because of the housing, the way it is right now. And just anyone that has any kind of housing insecurity, that's who we're working to help if they're a family with minor children. Most of the family promises still operate this way, but pretty much all of them start out as a shelter program. So we have our Bridge Housing Shelter Program, and essentially what it is a family becomes homeless, calls us, says they have nowhere to sleep that night, they need shelter. If they're willing to work with our program, then we bring them into our program. They are receiving shelter then with it's kind of interesting to explain this to people, so I'll try and say it in a way that everybody can understand what I mean. We have an office building and a day center, but we don't actually have a shelter. We work with 13 local churches, local congregations, and that is actually where the families sleep. So when they come into the program, they will go on their first night to whatever church is hosting during that hosting week. They'll go there about 5:30. The churches have volunteers that provide meals and play with the children, help with homework. If the families or the parents need any other additional things helped with, they will help with that. But the biggest piece of that is that these 13 churches are doing this for us 1 week a quarter and providing all these volunteers. So we do have over 1,200 volunteers that work with our program. The families get a lot of love, a lot of support, and a real good sense of community by participating in the program, because here's all these people that care about you, want you to be successful, are there for you, willing to sit and listen to you. Unfortunately, also one of our biggest drawbacks until now, so I'll explain that in a minute. We also do have an Open Doors program. In 2017, we were looking at, we always had a wait list for our shelter. We were always full, and we were always having 12 to 18 families on our wait list. We said, how can we do something else to help these families so that we don't have to tell them we don't have a spot? And the board realized that if we did homeless prevention and diversion, we wouldn't have as many families that needed shelter. So in 2018, we started the prevention and diversion program. We're able to pay someone's past due rent so that they never experience homelessness in the first place. We also have a diversion piece that we do move-in costs. So if a family, if their rent got raised and they can't afford it and they have to leave, a lot of families who are struggling cannot afford to save $3,000 or $4,000 for their first, last, and security. And so then they come to us, we can provide that first and last for them. All they have to do is the deposit. And then there are some other diversion things that we can do. However, in 2018 and 19, the board was kind of evaluating how much of an impact we had. How far had we moved the needle? And one of the things that our discussion revolved around was we're not really solving the problem. What does that look like? What does solving the problem look like? And we really decided that any of these things that we're doing already or that we could do are just putting a Band-Aid on it. We're not solving the problem of the housing crisis and homelessness for families. So what's the answer? Having housing that's affordable for our workforce. So they started doing our strategic planning, creating a bunch of proposals and looking into the community for what we could do. And in January of 2022, we bought our first 10 houses. And then in October, 2 days after the hurricane, we bought another 2 units. And we're in the process right now of buying another 2.5 acres to put 50 to 55 units on. That's where we're headed. We're headed to creating the workforce affordable housing that our community needs. So our funding generally for all of this is private donations, local private donations, local foundations, local events, and then our local city and county governments. We don't really get the state and federal funds, so we are using local funds to solve our problem here locally. Biggest reason, and I alluded to it a minute ago, but I'll say it again. The biggest reason that we decided to participate in the Trauma Informed Care Collaborative was because we, as a staff and a board, we did want to become more trauma informed, and there's way more to it. But the most important thing to us to solve one of our problems was getting these 1,200 volunteers trauma informed. All of these people that are interacting with our families who have dealt with a lot of trauma, are still experiencing trauma, haven't really gotten the ground underneath their feet again yet. And we didn't want those volunteers to re-traumatize them or make them feel uncomfortable in any way. I will go ahead and share with you one of the stories that really kind of hit me, that really caused me to say, no, we have to do this. And we applied with Gulf Coast. We had a volunteer who was making dinner for the families because they provide the food and the shelter. So they make dinners for the families. Sorry about that. And she had made a very extravagant, like a fettuccine Alfredo with broccoli and chicken kind of thing, but very interesting cheeses. The children didn't want to eat it. We had 3 families in the program. All the kids, there were 8 kids, and they were all under 10 years old, did not want to eat it. She was very upset. She was offended, and she canceled the volunteers for the next night, told them not to bring their hamburgers or tacos or whatever they were going to bring. She was going to reheat this casserole and have the families eat it. So we realized, and the families came to me crying, like, we wouldn't eat it last night. We told her why we wouldn't eat it. She brought it back tonight. And they were very upset. Sorry. So we knew, and that was not the only story. We had several stories from our families that there were some things that happened, and we just knew we had to get these volunteers at least to this level set of basic trauma informed care. So that's what we did. We do know now that our clients are happier. They're not struggling as much in the program, and with the volunteers and with the churches, they're having a lot better conversations. And we're not even to the point where we're done with it. We're creating a whole new training with the volunteers. There'll be new booklets. It's a new PowerPoint. There's going to be a video. We're doing it, and then the church is going to put that out in their entire church. So this is actually going to reach more out into the community than just within our organization. And that's why we wanted to do it. But we're all getting a lot, my staff, my board, everybody's getting a lot more out of it than that. Thank you.
Thank you, Jennifer. That is just fabulous what you're doing down there in Venice and surrounding areas. And it takes something, right, to learn about what people are going through if they've experienced a lot of trauma, and then they show up at your doors for help, or they go to the first night at church, and there needs to be an awareness that helps to be aware of what that's like for folks. And some of the things that we might think are okay, like fettuccine with all the fancy cheeses, can actually, it can really send a family or some kids into a tailspin. So we're learning, right? We're all learning. And I just want to emphasize that it's a learning process for the whole community about trauma and its impact and how we can avoid re-traumatizing people. So thank you. Okay, so our next speaker is PJ Brooks. He's with, again, with Castle Community Assisted and Supported Living. So PJ, I'm going to ask you to tell us about Castle.
Thank you. Good evening, everybody. Yeah, Community Assisted and Supported Living, as you say, Castle for short. We're a permanent supportive housing provider. And what that means is that first off, our target population, the clients we serve, generally come to us with mental health and/or substance use disorders, most of which are coming out of homelessness. And actually, I'm trying to change my vernacular because I've heard houselessness as a reference versus homelessness. I find that even in some circumstances that are not a shelter per se, but someone does still choose to make their environmental home. And I'm trying to change, so it's an evolution, and I think that this is represented in this. But we provide for many their forever home. We work with let's just say this, we have 1,188 beds through 9 counties in Florida. We have scattered site housing along with apartment style housing. Behind me, back this direction, is our first apartment complex, Arbor Village, 80 units. When it opened in 2020, 71 of the individuals that came into the apartment complex came out of homelessness. So that is our target. We have a number of other apartment complexes that we've developed, 4 others in the state, and another 5 coming on board, including another project in Sarasota. The important thing that I think that needs to be recognized, or you can choose to recognize whatever you want, but we are working with a population of individuals that often have, if you've heard of ACE scores, adverse childhood experience scores, which are the traumatic experiences individuals have in their lives prior to age 18. Couple that with mental health and substance use disorders and the consequences of those, and then let's just throw in a little bit of mix of trauma, of homelessness as the icing on the cake of the complex trauma that many of our residents are wrestling with. And we as an organization, though we are fairly broad in the scope of what we do, we keep it simple. We also provide case management services. We have case managers that work with our residents, and it's a roll your sleeves up case management, meaning you need to get to an appointment. Guess what we're going to do? Get in the car. Let's go. We're going to take you to your appointment, get you there, make sure that you're accessing the services and support you need. Along with that, we also have supportive housing specialists. These are non-degreed individuals. Some are, but really targeted at doing those roll your sleeves up and supports. And then we've also recently, over the last year and a half, started bringing on board recovery peer specialists, individuals with lived experience. And that has been a real game changer, because along with working on becoming trauma informed, we're trying to become a recovery oriented system of care. We do not provide any clinical services, but we work to ensure that we work with our so important collaborative partners, First Step, Centerstone, and actually these agencies that are here with us, all of us are partnered together. This is not siloed organizations that have all of a sudden come together by chance encounter because of this grant opportunity that Gulf Coast Community Foundation was so gracious to award. We have all been working together in the trenches, very much so. And this is a chance for us to have this joint experience and growth, that we recognize that we want to provide a better environment, a healthier, safer, and more resilient environment for our residents. Coupled with that, as a bit of background, I'm a licensed mental health counselor by training. Coming to the housing field but I've been working with it for many, many years as a treatment provider, and I'm embarrassed to say, not so much anymore, but it was embarrassing to fully recognize that, I never fully I understood the need for housing in a tacit way, but never fully recognized that if you don't have a place to lay your head, why the heck would you want to get sober? Why the heck would you want to work on your issues? All you're doing is just making yourself very clear-headed to see how bad it is for you in your experience. And with the acknowledgement of that, it's really a work in progress for us as an organization to address our environment, our approach with our clients and residents, and that in many respects, we are going to be working to not just bring folks into housing, but ensure stability in their housing. And that's one of the keys in our effort to become trauma informed. Also, it's important for us to recognize that many of us who come to this field, whether it be working with the unhoused to working in the mental health or behavioral health field, don't come just for fun. Many of us are guided here because of our own lived experience. And often if that has gone unresolved or is not addressed adequately, it can become a major impediment to have success in this field, and or you deal with burnout. And I think Taylor, was talking, you talked about vicarious trauma. When we're constantly dealing with issues of chaos that our clients and residents are struggling with, it can really bring about burnout and struggles for our staff as well. So we're trying to ensure that our staff are feeling supported, and I can say that one of the things that with this project, there's a number of things that have happened that I think we've accomplished in that, recognizing that we needed to do a better job of training our staff and providing it in a much more humane way, rather than scrambling around and say, here's your job, you got to do it, we got other things to do, and being more sensitive to that it can be an overwhelming process of bringing in a resident from homelessness to bring them into housing, as they're also having to deal with signing leases with us and all the other things that go along with that maybe they've never done. One of the things that came about is also recognizing the need to support with activities of daily living. A number of our tenants moved into Arbor Village, our apartment complex here, had no idea how to run a microwave, because they hadn't. They've been houseless for so long that was an experience outside of their what they grew up in or anything. And so those kinds of things that many of us may take for granted, we needed to be slow down and step back and recognize that there are things that we needed to be mindful of. So going forward, because I know we're getting tight on time, going forward, because this has been about a year process for all of us. We've really been working hard at this, and what's been really cool is we've not lost the energy. We've sometimes it can wane. I think we have kept our pace, and what I've recognized in our partner agencies is they have as well, which is really cool. But we are trying to explore ways that we can bring in different treatment modalities and that address trauma, because what we found is often the issues that result in any of our residents putting themselves at risk of losing their housing through an eviction because of behaviors, whether it be ongoing substance use that maybe disrupts their housemates or others, maybe mental health crises or other things that keep presenting, is often the core of it is unresolved trauma. So our goal is to try to bring into play opportunities for our tenants and residents to have that experience, and hopefully be able to dissipate some of those trauma experiences so that they can really thrive in ways maybe they haven't been able to before. We have with us, from Castle, Jerissa Negron's on. She's our regional manager. Lisa Moskin is our team lead here in Sarasota. And Jenny Makowski is one of our case managers that is here. And, I'm honored to represent them and the rest of our team. And this is exciting work. And I just in the fact that we're taking the steps, you can feel it. There's an intangible thing that's going on here within our organization that you can just feel. The turnover rate is steeply declining in terms of our staff. The energy that they're putting forth with our residents is ever present. And now, we've even broadened our approach to not just working in permanent supportive housing, but also exploring affordable housing, recognizing that many of our staff who work here in Sarasota often live far, far away because it's so difficult to find adequate housing and affordable housing in Sarasota County. So, we're part of it, and Jennifer Feigenbaum and all of us are working in Harvest House, and a number of us were able to take part in an initiative that Sarasota County supported with ARPA funding to bring on more affordable housing units that we're going to be working on, and then even growing further. So I'm going to shut up now. So I'm honored and I'm humbled to be here. So thank you.
Thank you, PJ. And it is palpable, I can feel the team, that people are passionate about what you're doing. I think they already were, but this is like on steroids, right? It's really great for our community to see you all embracing this and being creative with each other as a team and coming up with some wonderful things for your clients, your residents. So that brings us to our next speaker. Kelly Geeson is here today. She has been served by Castle and the team there, and she's going to tell us a little bit about her journey. So Kelly, I'll turn it over to you.
Okay. I don't know if you guys can hear me. My voice is messed up. But my name's Kelly. I'm 42 years old. I was abused since the age of 3 when my dad died, and his family blamed me for it, even though it was a car accident. My grandma made my cousins abuse me. My mom covered it up. It was made to look like I was telling stories so I wouldn't get taken away from home. And like life was perfect. So I ended up meeting my kid's dad when I was 16 or 17, and I was beaten for 13 years, locked in closets. I had 2 kids. He threatened to kill the kids if I would leave. He ended up trying to kill us all. I ended up saving the kids, and then I picked the kids over him, so he shot himself in my face. Then I lost my kids to my mom after that. So I had to go to rehab at the Salvation Army, but I ended up being trafficked out there by the wonderful men out there that hang out there, and got addicted to drugs. I was out there for 7 years. We were spit on by the cops. We were called the rats of the city. They told us we'd never get housing, so we might as well just sell our bodies. If we didn't want to do drugs, we were basically forced to do them. We were raped out there anyways. We weren't treated as human, so we just, were locked in the hotels there. I ended up, because of my mental and my trauma, the rehab just didn't work, even though I kept graduating from it. It just wasn't working because I couldn't get the help that I needed to stay off the drugs. I couldn't get the therapy. I couldn't take the medication because I wasn't stable enough. I felt safe enough to take it because it would knock you out half of the time. So by accident rehab, I ran into a lady that knew about Castle. It took me a couple more years to get an appointment in with them, but I never gave up on it. But I was so desperate, true story, honestly, that I slept outside the Castle building the night before the intake appointment because people were trying to stop me from getting the help that I needed because they didn't want me to tell my story. They don't want people to know this city has people like me that are being, basically trafficked. And if you try to leave, you get killed. I've had 5 friends killed last year trying to get into housing. But within meeting Castle, they treated me like I was human. I felt safe. I felt relief right away. They got me into doctor's appointments right away. They got me, tried to get my medication started. And within 90 days, they got me on the night before my birthday. I woke up into my own bed in a new home, and I've been almost a year sober. They got me, they're starting to try to get me into retreats for my therapy. I have trauma therapy started through Centerstone they helped me with. They helped me with getting me to my therapist. They also allowed me to have a emotional support animal, which has saved my life immensely. They keep me stable. They provide me with my medication if I can't afford it, the rides. They're helping me with Social Security, disability, the housing, food, clothing, support groups, the retreats. And there's plenty more opportunities still I'm waiting for, but they're providing. It's important for me to see if I can help others to receive the opportunities like I got, because not everybody wants to be stuck out there, and we all deserve to be treated human. And it's important because, especially being a woman out there, a lot of bad people are behind badges and are in charge of stuff out there too, up until now. So Castle was my only chance, because up until then, 7 years I was stopped from this. And like so many, at least 30 of my friends were killed, but 5 just last year. So it's just important for me to let you guys know how amazing Castle is, and how much and desperate we are for this. And a lot of us don't want to be out there and don't want to be looked at as bad, but we just don't have any other opportunities, and we are forced to do a lot of it, and we act like we like it, but we don't. So I mean, it's thank God for all of you guys, because there's such a need for it. I mean, there's women killed out there every day, and it's horrible for me. I'm blessed that I wasn't one of them, and it's thanks to Castle. So thank you all.
Kelly, thank you so much for your generosity and sharing that.
Mhm.
I'm moved. I know everybody on the call is moved by your courage and by your resilience. We talk a lot in this arena of trauma about resilience and what it takes. And you're just like a shining light of what it takes. And yes, you have people from Castle and other places with you, but you're the one. You took it on. And so thank you. And thanks for being willing to
you, guys.
share this. Yeah.
No problem. I want to help others. We are out there. We do want to change. It's just hard to get the help.
Yeah. Yeah. And we get your commitment to help the others too. And I know that's part of why you did this tonight. So thank you.
Thank you so much.
Yes. Stay
God
with
bless
us.
you guys.
Okay. Can
Okay,
you
I
stay
will.
with us for a little
Yes,
bit?
ma'am. Yes, ma'am.
We would love
Thank
that.
you. Okay, thank
Okay.
you.
Thank you, Kelly. Okay. Whew. I knew you would knock our socks off. That's what you just did. So let me gather my breath. And we're now at the point of our community conversation where we want to ask you, the community, to come off mute if you have a question or a comment that you'd like to engage with all of us with. If you prefer, like Sonia just raised her electronic hand on Zoom. So I'm going to call on her first, but you can raise your electronic hand. You can wave at us, put something in the chat, whatever works for you to get our attention. So let's start with Sonia. Okay.
Thank you so much. And thank you to everybody who shared tonight. And I just want to take a moment and say to Kelly, I am so, so proud of you. And thank you so much for sharing your story. I believe I know you. I've met you before over by the Salvation Army, and you have just radically changed. And I'm so proud of you. It's really just amazing to hear your story. And I want to just reiterate something that PJ said and something that Kelly said, because I think that it really just needs to be drilled in. And that is that people cannot change their life when they do not have a safe place to be. Unless you are safe, you cannot heal from trauma. You can't overcome addiction. You can't stabilize your mental health. None of those things can happen until you have a safe place. And Kelly's story is absolute proof of that. So I'm just so glad that I got to participate in this conversation tonight. And I have a question for all of the panel members. And, PJ kind of touched on it a little bit, but I just want to kind of see what you guys are thinking about it. I know the housing crisis has been amplified, right? In the last year or two, it has just gotten so much worse, and it's so hard for people. And I'm just wondering, what differences are you seeing in the last year or two, and what kind of changes do you know of that are being made to help combat this housing crisis right now?
Andrea, can I speak on that real quick? You're muted, but
Go ahead, Jennifer.
okay. One of the things that has happened very recently is the Lift Local Act. And I don't know if you've heard of that. So it goes into effect July 1st. And it is essentially going to make it possible for communities and nonprofits to create the affordable housing that is necessary. DeSantis signed it into law back in February, March, and it is cutting through a lot of the red tape, and it virtually eliminates NIMBY. A lot of people can force affordable housing not to happen because they don't want it located near them. If you look at the law and the way it's written, if it's zoned industrial, if the land is zoned industrial, commercial, or mixed use, then you actually they're not allowed to hold a public hearing to hear what the public has to say about it. They have to approve it for affordable housing. So I think that's going to make a huge difference. It's just all everybody's kind of trying to figure out really what the law says right now, but that part is pretty clear.
Yeah, the key will be with the Live Local Act that because it allows for affordable housing, what they call affordable housing, up to 120% of AMI, which is just understand that that's not affordable. AMI is area median income. Okay, so what they do is they look at the median income for the community, and we really have to target below 80% for this to have any meaning. We're talking really 60% and below if we really wanted to have any real impact on the affordable housing issue in Sarasota County. But there are those opportunities. Our hope is that the development community will look at this as an opportunity to be supportive. And I can say this, that the Sarasota Area Chamber of Commerce is going to be working on implementing a summit to bring the developers in the community to talk about this issue, to try to bring them forward with that, and to hold them to account, because there is a part of that does need to happen. Many organizations want to bring in affordable housing, like us here that are here today, but there are others that will look at any way to skin a cat. Unfortunately, I'm a bit jaded, having from many years of looking at some of this stuff, and but I think that there are some other opportunities.
Great. Thank you. Thank you, Jennifer and PJ, for letting us know about that. And, as the chamber summit develops, PJ, if you can let us know, or if there are other things we should pass on to this group, we may be able to do that through the SRQ strong list. So thank you. I'm going to go on to Deb Clark. She's had her hand up for a little bit. Deb, did you have a question or a comment?
Yes, I would. I don't know if I missed it and couldn't hear it, but I was wondering, what are the stipulations for people if they're applying for housing? What do they have? I mean, I would imagine that they have to have a job or try to get a job. Or what are some of the stipulations to do that?
So I can answer that. Here in Sarasota and Manatee County, we operate on a housing first model. So what that means is it is extremely low barrier. There aren't, programs that people have to follow. They don't have to go to treatment and get sober before housing. It is basically, if you, are in need of housing, whether, you're referred to like a permanent supportive housing project, rapid rehousing, the goal is to get people in housing and then figure out what do they want to do from there on their journey to, becoming self-sufficient. Some folks will always be in permanent housing. It's just the nature. Some people just cannot sustain for various reasons, mental health, income, things of that nature. But all in all, we do operate on a housing first model and have adopted that as a community. So income, having a job should not be an issue. And I think a lot of people on this call tonight have said it. And PJ, you said it beautifully about, basically, how can you have, you get sober and, you're understanding your homelessness in that aspect. So I'm off track here, but what I'm trying to say is, if getting people in housing is the way to help people become sustainable. It's very hard to deal with trauma and, substance abuse, mental health, if you're having to fight the elements outside and everything that's been discussed this evening. So.
Yeah, the housing first approach really is just that. It's get them in as rapidly as you can. The challenge is having enough openings. That's the big roadblock we're all dealing with right now. We have a lot of vouchers that are out there that folks have the ability to pay rent because they've received a supportive voucher, usually through the COC, and they can't find a place to house to use it. Because there just aren't enough, there isn't enough rental units available and or landlords that would accept the vouchers. So, but yeah, it's getting them in and then work on the issues. And if it's, you can lead a horse to water, but you can't make them drink, but you sure as heck can make them thirsty. And, it's getting them in so that they have that opportunity to be safe first. Then they can go on work on the other things.
Are people with children higher priorities than say single people?
So I wouldn't necessarily say that, families are a higher priority. How our system works is anyone that's experiencing literal homelessness would go to what we call an access point in the community. And they're throughout Sarasota and Manatee County. The first, step would be diversion, early intervention. So if we can try to, divert someone from entering the system or, rapidly, getting them rehoused and not, having them sit in, the system, that's always the best line of, defense. But what happens is if, a person can't resolve their housing crisis, they go through the assessment, they're put on what we call our community by name list. And then we prioritize folks for various housing interventions. Which could be, permanent supportive housing. It could be rapid rehousing. We look at a number of factors when it comes to prioritizing folks. In our community, we look at their acuity score on the assessment. So basically how high of need they are. We look at the length of time they've been homeless and then when they actually came in for that assessment. And then we basically prioritize from there. We do have a significant number of folks that are experiencing chronic homelessness. So we try to ensure that the resources that we get those people into housing as quickly as possible. We kind of have to look at it, as if this were an emergency room. So if we have someone that comes in with a broken toe, or we have someone that comes in that's having, a heart attack, we want to ensure that we, help that person that is having that heart attack first and foremost, and then provide, maybe a lower level of care for that person that has that broken toe.
And for the housing units that Family Promise is creating, they are not part of our programs. We're calling it sustainable housing, and it is just workforce affordable housing. It's at an affordable rate for our workforce, meaning if you work at Publix or Walmart or a restaurant, or the rents are currently the first 12 houses, the rents don't go over $800 a month. And any housing that we build after that, and it's not, our program serves families with children, but these sustainable housing units and the many more to come will just be for our community, for our workforce. There will be no requirements. You will work with Suncoast Partnership and Castle and all the other agencies and the community to get people housed.
Thank you for your question, Deb. I wanted to, Kelly, can you see the chat? Can you see the chat? Okay. There are many, many comments thanking you, Kelly, in the chat.
I also have one on Facebook too, to said make sure to thank Kelly and all the speakers, that they really appreciate your generous sharing. So people on Facebook as well.
So I wanted you to know that, and Kelly, we may have a way, I think, Annalise, can you capture the chat after the meeting? So we'll get those to you through Lisa or Jerisa or something, so that you can see the beautiful comments. People are so moved by what you shared. Thank you.
Thank you so much.
You bet. All right, other questions, comments? Things you want to know more about. When I started working with these agencies, I had no idea about all these different programs for people to get housing. There are these acronyms and names of programs that we throw out. So if you want to ask about things like that too, you've got some experts here.
Andrea, this is Kathleen. There are a couple questions in the chat we might want to pick up on. Ronald Larson asked whether it is mental health or addictions, what can be done to get people stable before achieving housing? And then there's a follow-up question with regard to where does harm reduction fit into all of this before or after housing? But Ronald, I'll let you add any further to that. I just didn't want to miss that in the chat.
Thanks, Kathleen. Always the facilitator. Thank you so much. Ronald, anything you want to say about that? Okay, does somebody want to answer the question? Do we need to repeat it? PJ, Taylor?
Yeah, gosh, I'm sorry for hogging, not my intention. I just have a big mouth. The housing first is really harm reduction. It's really, what that means is the expectation is not that they come in. Now, when we say stable within reason, if someone needs to be in a crisis unit or stabilized through a crisis unit, or through sobriety, through a detox unit because of that out of control, you would want them to complete that first, but then it's not of the expectation that the person comes in sober or comes in, stable on their medications. Again, as I said during my discussion, how can you expect that when you're out on the street? And so we get them in first, then work on the rest of it. The rest of it will come in time. And even with Arbor Village, when we first opened, I think only about 30 of the residents there were participating in case management services. Now we have about 64, and we've had a 90% retention rate for after 3 years of operating in Arbor Village. That's better stability in terms of rents and otherwise, and stable housing for individuals than you would see in traditional apartment complexes. So we're very proud of that. And a lot of that has to do with because of the roll your sleeves up work that our staff are doing with them. And many of these agencies that are here doing the support do the same thing. And, so anyway, but that's what it's all about.
Yeah, I would just add that with Housing First, it's about meeting clients where they are and understanding that many of our clients have experienced homelessness, and like our staff have been talking about recently with the recent learning collaborative, is really seeking to understand and maybe why a person is doing something maybe related to a trauma that they experience, how someone reacts to something. We may say, oh, I don't know why someone would react that way, but we don't always understand the trauma that person has experienced, and that sometimes people are responding, have a trauma response to things. So
Yes, thank you, Taylor, for saying that. That's one of the biggest, I think, benefits. One of the benefits of this whole project, HEAL, is that we're all starting to ask ourselves, is that person's behavior perhaps attributed to an unresolved trauma or a trauma in the past that maybe we wouldn't have asked ourselves that question in the past, and maybe we wouldn't have had the same kind of compassion or way of handling and dealing with the issue. So it's huge. And what I love from SRQ Strong's point of view is that now all of you are looking at life that way, looking at people that way. And so as you're out in the world, in your community, you are helping to make this a community that cares for itself. So thank you all for that. Other questions? Anything else, Annalise, in the Facebook Live questions?
Nothing else on Facebook. There was one much earlier that I was trying to scroll up to find. Someone was asking, let me see, will you have shelters for homeless families in Manatee? Have you contacted churches yet? But it looks like Jen may have already responded back. Maybe if you want to talk about that a little bit for anyone who maybe can't see our text boxes here on Facebook, maybe talk about that.
Okay, sorry, I didn't realize that. I don't know.
No,
what
that's
the hell I
okay.
thought I replied to, so everybody could see it. I only serve South Sarasota County, so the cities of Venice, Northport, Osprey, Nokomis, and Inglewood. The Family Promise up in Sarasota serves the north end of the county, the city of Sarasota, and they serve Manatee County. So you would have to, if you're talking about Manatee County, you would have to contact them. We don't step on each other's toes. I do occasionally serve city of Sarasota clients, but it's a partnership thing. It's something that they may not provide up there, because for the same reason, we partner with Castle, we partner with Harvest House, we partner with all the other agencies. When we have someone come to us that's not something we specialize in, don't reinvent the wheel, send them to the people who actually know what they're doing. And so we have, for example, if we have a family that comes to us and doesn't have a job, it's not that we're not going to provide them shelter, but I'm not going to try and help them figure out how to get a job. I'm going to call one of the other agencies that does that, Career Source, Suncoast, Goodwill, Job Connection, get them a meeting with them. So we all work together, and we've been meeting for years and having these conversations of how we can collaborate and work together. And to tell you the truth, I meet every month with the other 200 and some directors via Zoom, and we have monthly director meetings, and across the country, they're all just shocked and surprised by the amount of collaboration and communication that we have in Sarasota County, how well we work together, that I even actually know what's going on at these other agencies and have conversations with the people there. That it just doesn't really happen anywhere else. So that's an amazing thing that we've got going for us. We're doing amazing with that.
Yeah, thanks, Jennifer.
In Manatee County, they recently have undergone basically a study through the Florida Housing Coalition. We did that in Sarasota several years ago, and basically a roadmap has been created to address homelessness in Manatee County. And one of those pieces is developing and expanding shelter for families in Manatee County. Right now, the shelter is very limited in Manatee County through the Salvation Army in Manatee County. So looking to try to expand those services. We've done a wonderful job here in Sarasota when it comes to serving families. Great partnerships with Harvest House and Family Promise. So what we have built in Sarasota and what we know that has been successful, we're more than happy to try to support Manatee County in building a family system to help address the homelessness there as well. So we may be calling on some of you in Sarasota County to bring your expertise. The great thing is that the Board of County Commissioners in Manatee County, we've seen quite a drastic change, and they're really involved and invested in this. So that's always a positive. And that the citizens in Manatee County are, wanting solutions and wanting to look at, okay, what happened in Sarasota? How did they address it? Can we do this in our county? So excited to see what happens in Manatee.
It's really great. Thank you, Taylor. Let me go to another question in the chat. Tracy asked, if someone is using drugs or alcohol in the units, how do you address that?
Well,
PJ?
Yeah, for us, we actually, that's where you work with a standard lease. When you have a lease, if someone, if we have someone who's being disruptive, it's about the disruption in, like, if, for example, if we have 3 individuals in a house together and one of the housemates is actively using and it's causing a disruption in the home and other things like that, we work to remedy it from that perspective. Now, we do everything we can to avoid evictions and other things like that, to include, if need be, we would work with them to terminate the lease without an eviction if we had to move towards moving out, so that they don't have that on their record. But we work to, as much as we can, to engage them in the services and supports they need. But yeah, you used that's what standard leases are for, and we can use that as an instrument as necessary.
Yeah, and I'm sorry Harvest House is not on with us today, but of course they they do a lot of work with their residents on addiction and recovery. And I know that John Lopez would have talked a lot about that today. So if you know someone who's in that situation who, is perhaps about to be unhoused and has an addiction issue, some of these agencies would be important to seek out and talk with.
And that's where the peers for us, the peer support is so important now. And we, with having individuals with that lived experience be able to make those kinds of contacts, to have, be able to talk through what they're going through and what they went through. Sometimes our case management team won't be able to have that kind of breakthrough that the individual lived experience can. So that can be a real important step as well.
Yes, absolutely, PJ. Thank you. Okay, so we're coming to the end of our time. Is there one more burning question we should answer before I make a few closing announcements? Okay. Annalise, anything you're seeing in chat or Facebook?
Nothing more on Facebook. I think we got to pretty much all the things in the chat here.
Okay, great.
Excuse me.
Marjorie, did you have a question?
Yes, I do. My name is Marjorie. I'm with Vibrant Recovery, and I just wanted to ask the question. I know a few of the people here. I've worked with them and spent time in different capacities with them. So I wanted to find out, how does an organization that is new, a peer-led organization such as mine, get involved in the housing and Housing First initiatives?
Anyone want to, Taylor, is that a question for you, perhaps?
So, and Marjorie is part of our continuum of care. We're so glad that she has decided to join us. And I know she's very involved. I've seen her on a lot of the different meetings and at the different trainings. And I know that she is, really working hard to get her organization up and running. She does a lot of really great things for the community. I had a conversation with her and was really, excited to hear all the things that she's done. I would really say, maybe trying to partner with some of these agencies and see kind of, maybe how they have done things and see what kind of tools, that she can learn from them. And then trying to go after, funding opportunities. I always say that, I deal a lot in the contracts and grants world. So sometimes the government grants can be a little bit difficult. There's a lot of prerequisites, different requirements, but there's also a lot of really great private foundations that kind of maybe can provide maybe some seed money to kind of help your organization grow. And then, finding, I mentioned kind of this a little bit earlier, but mentors, people that kind of do what you do or kind of, what you envision, just, having them mentor you.
Okay.
Marjorie,
you.
someone in the chat asked, what is the name of your organization?
The name of the organization is New Creation Ministries of America, DBA, Vibrant Recovery.
Aha. Okay, great.
Yeah.
Vibrant Recovery. Great.
Yes.
Thank you so much for being with us today.
Absolutely.
Thanks.
Thank you so much for doing this event and putting this online. And thank you to, I believe it was Kelly who shared her story earlier. Very powerful. Thank you so much for doing that.
Great. Yeah. Thank you, Marjorie. Okay. Well, we're going to wrap up today. This has just been a great conversation, and I want to thank our speakers, PJ, Jennifer, Taylor, and yes, especially Kelly for being generous and sharing her story with us. So inspiring. Thank you all for coming and participating, asking questions, giving us comments. We so appreciate it. we would love to, again, have you send us, if you have ideas for community conversations related to the trauma work, related to resilience. We're always looking for topics and speakers, so you can send us an email or go to www.srq. Tell me, Annalise, I'm forgetting if we're Sarasota Strong or SRQ Strong on the website.
So I know it's so confusing. Sorry, guys. So it's sarasotastrong@gmail.com, and then it's www.srqstrong.org. Sorry.
Great. Thank you.
So,
Thank you. Thank
yeah.
you.
And
And I wanted,
oh, go ahead.
no, that's okay. You go ahead. You go ahead.
Well, just before we completely wrap up, we do have like just a tiny little questionnaire at the end before we end. So before everyone completely disappears, if you have a moment to hang around and just answer a couple questions, that'd be great.
All right, great. Will they answer in the chat? Is that how that works, or?
So I'll launch a poll as soon as you're done, and then that'll kind of
Okay.
be like our ender.
Okay, great. I'm glad you reminded me. So stay on the line if you can and answer the question. This was recorded. I want to remind you, so you'll get a link to the recording if you want to look at it again. Maybe you missed something someone said or want some particular piece of it repeated for you. And you'll be able to view it immediately in our archive of Facebook Live videos on our Facebook page. So just know that you can have access to this again if you missed something. Again, we just really appreciate all of you being with us tonight. We love having these conversations be geared toward what our community members want and want to learn about. So please do email us again at sarasotastrong@gmail.com if you have any comments or questions. So with that, I'm gonna turn it over to you, Annalise, to put the question up, and just thanks again, everyone, for being with us. Please answer the poll if you can.